Site. So you go to the PCS website and there is a drop down link that says I want to, and you go right to kindergarten registration and it has everything that you need right there. So some of the things I'm going to talk about will be there. The forms will be there, the dates of when the principals will be having their open their registration times for you to go in and meet them and possibly have your child assessed and all the sign up for transportation, all the things. We also obviously provide everything in both English and Spanish, and most of the registration sessions take place in the media center because such a large group will come at several times. Those times too are mostly during the day. Some schools do have it at set times. So again, you would go to that website and whatever school you would attend, it's going to have the dates and the times for you. All right, these are the things that you need to have that's required. You also, if you haven't had a chance to, we're very proud of this booklet. It's the ABCs. Everything that you need to know is in this booklet. So I kind of hit some highlights, but do pick one up on the back table before you leave. So you do have to have a proof of age, immunization, which we have some wonderful physicians that are going to talk about that today. And then 2 proofs of residence, such as utility bill or phone bill. If it's a guardianship, you will need a court order, and then the health assessment, which again, they will speak more about. Next slide. So, it's already been mentioned about the school tour. I highly encourage you to do that because not only are you able, to see the classrooms when there are students there, but it's also good for your, little one to be able to see the kids in class. Helps with anxiety when they want to start school. And the principals actually really take a lot of time and pride to go through the school and answer any questions. So it's really like a one-on-one with the principal as well. So we do encourage those tours. Also, it's very important to open house. So even if you go to a school tour, you go to registration and you sign up, we have open house in the fall. And that is when really the transportation and also child nutrition and things happen during that time. And you'll receive more information. And I often get asked what happens during an assessment. It's very minimal. Pretty much it's, they count 1 to 10, they go through the ABCs, they might have some other manipulatives there to be able to see what they can do with positions. But it's not really that as intense, but I'm gonna go more in depth with that. Next slide. So what happens when they actually are enrolled and they show up to school? So literacy. So what does that look like? That is read aloud, teacher model reading, small group instruction. So they'll have time in think of a horseshoe table with a teacher and they would go through with a group and then they rotate through stations. Letter sounds, rhyming, beginning sight words, and center activities. Writing is essential in kindergarten. Times have changed where that was mostly we had in my day, because I'm much older, we had the little kitchen set and we would play, and cook, and it was more of that type of environment. Now it is much more rigor, and so we do have expectations about being able to retell stories, to be able to start writing in kindergarten and completing sentences. Often the goal is for them to have at least 6 to 7 sentences to be able to write by the end of the year, and they do a phenomenal job. Expectations are high and they do well. And then you can see the list of a variety of ways they write. They can start labeling things, they make lists, stories, and journals. Math, numbers, counting objects, forming groups, shapes, and measurements and graphs. We do that in kindergarten. That is an expectation of the standard course of study that we follow in North Carolina. And solving word problems, it begins also in kindergarten. And then we don't forget science. A lot of our kindergartners love that the most because obviously they can do experiments in class. If you remember the volcano, all of us had to create a volcano and put baking soda to get. We do that in kindergarten. I think that was started 4th grade for me. Now we do it when they're 5. They learn how to go out in nature, identify certain types of plant life. And learning about weather is essential. That's one of the things that they do in kindergarten. So we always suggest to parents, when the weatherman's on, that they learn to listen to the meteorologist, and then sometimes they report that back to school. All of those things are real world experiences. And last but not least, next slide, is social studies. And the principals and I often think this is one of the most important, because this is where we're teaching them to be good citizens, how to get along with others. If they don't have siblings, sometimes that's difficult when they have to share and learn how to interact with others. So this is done often by the first couple of weeks of school, how to stand in line, how to get along with others, how to share, all those things, to help them make them productive citizens. Is we use all of those things. We have what's called morning meetings. And what that is a check-in with our students. How are they feeling for the day? They pose a topic, they just have conversations. Sometimes we learn a lot about how many dogs and cats they have, and they can go into elaborate stories. As I'm sure you've heard, when are you going to enter this sentence? They like to share a lot with all of us, but that's okay. That's what we would like for them to do. Next slide. Oh, so I think we have questions at the end. But again, I'm Lisa Tate, and I'm very happy to answer any questions that you may have after this meeting. And you can also find my email address on the website, and I'm happy to answer those as well. Thank you.
Thank you, Lisa. One thing you'll discover about Pitt County Schools that I love and appreciate is how accessible our leaders are, whether teachers all the way up to the district office. And so thank you, Lisa, for sharing that. So I like to say that she gives like a 30,000 view of what she talked about. And then we like to invite a principal that kind of talks more specifically about what are those things that as a elementary school principal that they would like you to know in ways that you can be engaging your children and preparing them from that perspective before they walk into the building for the first day of school in August. We've invited Dr. Briney, principal at Winter Green Primary and Intermediate Schools, to share with us this morning. Thank you for being
here. Good morning, everybody, and welcome. We appreciate you taking the time to be with us. Because the number one thing, our job as parents is to advocate for our students. So being here today was the first step in advocating for them and helping them get prepared for kindergarten. So we appreciate that. One thing, when Josh asked me to come speak to you, I was excited because this is an exciting time for us. When we have our new students come in the building, it's an important time for us to welcome them and then let them know that they're going to be safe, but also let parents know that your kids are going to be safe when they come with us. That's our number one responsibility, to keep them safe. We keep them safe, we form those relationships, and then that's when education happens. We can go to that next slide. So there's some first steps. As Ms. Tate mentioned, the school tour is a huge piece. You're already here today getting the information, you're engaged with us. So go ahead and get that QR code and find out when schools are having those school tours. That's one of my favorite things to do, is to walk around our school, brag on our teachers, brag on the students about all the great things they're doing, and then have the opportunity to ask questions that you all have. We want you to come into our building being informed rather than coming into the building not knowing what's going on and then have the questions. So we want to give you a front load you with all those questions and information that we can have. The other important piece is to register your child. It's amazing how many families we have come register the first week of school, or maybe the week we're getting ready to start school. Well, that makes it a little messy when we're trying to find a teacher for your child. When we're trying to get a desk set up for them and get their cubby set up and get everything labeled for them with only a short time notice. So every school is going to have the opportunity to do kindergarten registration. A lot of schools offer 2 days to do that. Some offer during the workday, some offer during the evening. Everybody's schedule is different. So at the same time, if you can't make it during registration, that's okay. You come to us another day and we'll be sure to bring you in, give you some information, get you registered so you're ready to go. But the big piece is let's make sure we get registered well ahead of time, really before summer even starts. The other piece is attend kindergarten assessments. They're very basic. We're not sitting there and drilling your child with a bunch of questions and a bunch of assessments, but we do want to know what they know. So when they come to us, we're fully prepared to meet their needs. The other piece of that assessment piece, a lot of us at schools will give a parent information slip for you to fill out regarding your child. Be upfront and be honest about that. We don't form judgments on our kids. One thing we want to know is if this child's a gifted child, well, we want to make sure we're putting them with a teacher who has strengths in teaching gifted children. If the children have behaviors, I have 2 children of my own, so believe me, I know about behaviors. But we want to make sure we put them with somebody who's going to be able to help with those behaviors and get them acclimated to the building the first week or 2. So again, we don't form judgments, but it helps when we're all on the same page. We're honest about that. The other piece would be meet the teacher in advance. So we have the open house piece. Personally, over at Wintergreen, when we have our families come in, our teachers and myself are given, well, let's say for the registration piece, we have our teachers walking the students around the building. So if you bring your child to register with us, we're giving them a school tour. We're taking them into kindergarten classrooms. We're introducing them to teachers because it's important for them to see those faces. And that's the same thing during assessments. We'll have one teacher give them the assessment, but they also have the opportunity to meet the entire kindergarten. Next slide, please. So be organized is what I call this slide. We want to make sure, again, as we talked about, coming to school to register, we want to make sure that our students are coming with the supplies that they need. Every school will push out a supply list, and it's fun. It is a fun time for our kids. You know, my wife loves taking my 2 girls to go get their school supplies. That is the time of year where they get excited. They're starting to get amped up for school. Have your child be part of that process because that's going to get them excited. They see all this new stuff. They get that new book bag. You know, back in my day, we had a trapper keeper and the little lunchbox that we would carry with us. That was an exciting time for me. So take your kids out school shop and let them be part of that. Get into a routine and make sure your children and your child is getting a good night's sleep. You don't want to be running around the first morning of kindergarten trying to get your child ready for school. Make sure they have a good night's sleep. They have a good breakfast. You're in line. All our schools allow you to walk the children in. Most of our schools allow you to walk them in that first day, maybe the first week. Every school's a little bit different, but take that opportunity. It helps your child. It helps you adjust. Full transparency, when my first one went to kindergarten, my wife couldn't do it. So, you know, Josh was like, it's a tough time. Taking your child to kindergarten, it's tough. I'll say, I'll do it. I'll take her, no big deal. I get in the car and I'm like, I don't know if she's in there. And my wife's like, toughen up, like she'll be all right. I'm like, okay. But you're gonna go through those emotions, okay? And that's okay. That's part of being a parent. It means that you care. And it means that you want your child to be successful. Okay, so that's not a problem. But that night before, get in the routine, get everything packed in their book bag. This is super important. Label your child's stuff, okay? Especially if they're riding the bus. We have a handful of kids every year come to us. They may have gotten on the wrong bus. They don't have a name tag, and we ask them what their name is. Jojo. Okay, Jojo, what's your last name? Oh, no. So we're playing for, you know, we're wasting, I don't want to say wasting, we're spending 2 hours, usually that first couple of days of school, trying to identify a child. Label your student stuff. So all we have to do is look on their book bag. We go in their book bag. We look in their notebooks. We look in their lunchbox. We see if there's a tag on their book bag. We look in their jackets to see if anything's labeled. We want some type of identification so we can look them up. And if the child gets on the wrong bus, at least we have a name. We can look them up in Opus. We can look them up in Power School, find out what school they're supposed to go to, call the family, call the school. Hey, we have Paul, just got on the wrong bus. Let's figure this out. How can we get them to you safe and sound? So that is a big piece. Label your child's stuff because it happens every single year. And then the other piece, again, we talked about getting up early. Okay, just make sure that you have plenty of time and that you're excited with your child and that you're supporting them during that time. Next slide. All right, here's what we said the students should know. And every child is different, and that's one thing we know. I've been in this game for a long time, and I fully understand, especially with my 2 children, every child is different. But if we can work on this stuff, this is things that help save our instructional time. Many classrooms in kindergarten are filled maybe anywhere from 16 to 21 students. You know, most kindergartens have full-time assistants, which is helpful, but at the same time, if somebody's out, you have one person trying to deal with that many younger children, which is difficult. And we also want to make sure we're protecting the instructional time. So the big piece of that is, again, them knowing their full name, them being potty trained, able to button their pants, unzip their pants, button jackets, coats, things along those lines. Our kids have a tough time opening milk. Okay, that's one thing we spend the first few weeks on at lunch. We're walking around, opening up our students' lunch boxes, their chips, their milk cartons. So practice that stuff at home with them. Help them get that craft of things so they're able to do that. Not because we don't want to do it, but constantly walking around that cafeteria, helping 20 students or so. You know, by the time we get to everybody, that's limiting their time to eat. Covering them in the classroom all the time, every time they leave the bathroom, doing the buttons, things like that, doing the zippers when they were losing some instructionals. So there are little things that you can do to help your children. And then also we talked about, or I'm going to talk about buckling and unbuckling their seatbelt. Okay, so when we have if you're taking your child to school, a lot of us do kiss and go lane. So you're coming through the kiss and go lane over at Wintergreen. We're out there opening the doors for our students, closing them. But it does take time. We have about 300 cars at Wintergreen come through our parking lot within about 20-25 minute period. And that's a lot. We're backed up the first day, first week of school, all the way to the sheets on fire time. So we're trying to get everybody in and out, and it's difficult when we're doing the little things like that of buckling, unbuckling, having to walk around to get them out on the left side of the car. If you can get them on the right side of the car, things like that help out the school a whole lot. All right, next one. Then we have readiness skills. Okay, and what I did, I printed out a couple hundred packets for y'all. It's just 3 sheets all together. It's kindergarten A to Z, and it has just letters from A to Z, what you can work with your children on. And now's a great time to start working on it. Work on it throughout the summer with them. And then on the back of that, I have a 2-pager that's readiness skills, and it breaks down these a little bit for you in regards to what they need to do. Again, every child's different. Do not get frustrated if your children can't handle everything right now. That's our job. Okay, partnership with you all makes it easier on us and helps us and helps our teachers get your children and our child above and beyond where we want them to go learning expectation wise. But again, this isn't where they need to come to us, and every little thing on this list needs to be mastered. Okay, but it is something for you to look at. That first thing is just writing letters. Okay, have a pencil in their hand, start working with their graphs, forming letters, especially the letters in their name. If they can come to us writing their name, that's a huge plus. The other piece is letter recognition. Go to the dollar store or take some index cards and make some letters, uppercase and lowercase letters. Sit down with your child. I have a daughter now who's in 2nd grade. Everything to her is a contest. So she wants to sit there and tell me how long it takes me to do these addition facts. Okay. All right, tomorrow, let's see if we can get that lower. And that's just the way she is. And that's one way that you all can look at it. Okay, how can I make this engaging for my child? So go ahead and start looking at uppercase, lowercase letters. When you're going through them, what sound does this make? Ask them the letter sounds and help them with that. The other piece is the number recognition and counting. The counting piece is super easy when you're setting the table. If you're pulling out chips and little pieces of candy, ask the child to count how many there are. Have them again with flashcards. Numbers 1 through 10 is a great start in kindergarten. Start going through those, see if your children can get those and help them identify those numbers. Shapes and colors are important. Then we talked about being able to hold a pencil or writing utensil. Help them with scissors. And scissors are a difficult task for our students. And there's a lot of cutting involved in our younger grades. So that's one thing that you can help with. The reading readiness, what that means is being able to identify a book. And we read left or right. What is what's on the cover of a book? What's the title? Who writes a book? The author writes the book. Who does the pictures? The illustrator. Have that conversation with them. Okay. If I was not in education, full transparency, I would never probably with my child. I would have been go to kindergarten, have fun, and let's figure out what we need to do. But we've been doing this a long time. Okay, so these are great skills to have with your child and work with them on. Attention and following directions, making sure that they're listening, making sure that they understand there's going to be other students with them, which goes back to that social skill piece. Get them out to the park, get them playing with other students that they're unfamiliar with. If you're coming to church or a local organization, feel free to let your child play with those who they do not know, because that's what school's going to be. When you're going to a class of, let's say 20, you may know 3 or 4 kids, but there's going to be a lot of kids that you do not know. A lot of kids with behaviors your child may not display, just different behaviors. Everybody again is different, so your child needs to be exposed to that stuff as much as possible. So it's not a success. And then if you take a look up here, I'm not going to read any of this to you, but this is one of the packets that is up there in the back. Okay, so I have them stapled together. Feel free to take it with you, and then begin working on it with your child. Baby steps. And again, you can't expect them to know everything within that first month. If they can master half this stuff before summertime, and master the other stuff before first day of kindergarten, well, then you're making great progress with your child. I'm going to remain here, so I'll be happy to answer any questions afterwards. I'll be in the back or just to the side. I'm happy to answer any questions pertaining to Wintergreen or any other schools here within the county. I may not be able to answer specific questions, but again, questions more so when I say specific questions to any other school. I can answer them to Wintergreen, but we're happy to partnership with you all. And our goal is to get this ball rolling in the right direction, so you're comfortable as a parent and your child's successful when they're with us. Thanks, everybody.
Thank you, Dr. Briney. And next, we're going to invite up Karen Harrington. She's going to talk to us about PCS open enrollment. You're the Director of Student Services, correct?
Yes, sir.
Perfect, correct. Welcome.
Thank you. It's so nice to see so many people here, and this is probably a biased statement, but certainly so glad to see so many dads here as well as moms. So thank you for coming and being interested in, getting your kid ready. I am the Director of Student Services. And I've tagged on an assignment. This year I have taken over the open enrollment process. So it's a learning curve since October. But I wanted to just speak to you briefly about enrollment as well. And I know you have some information from Ms. Tate and the booklet there. But enrollment information in general, like if you want to go to your home school, your district assigned school, is located on the website. It talks about all the required documents. Again, some of the information we have here today, we'll talk to you about those as well. You can complete the application ahead of time via a PDF file. We're not yet online. We are looking into that for the future. And then this will be reiterated as well, but this falls under me and ends up an issue every year, is that schedule that health assessment and immunizations early. If you're not already in compliance, schedule them now, because as we get closer to the date, 30 days after school starts, if your child has not had both of those completed, by North Carolina law, they have to be suspended from school. And we don't want to ever exclude a child for that. If your child is going to regular well child checkups, they already probably have the required immunizations, or they're coming due for it when they turn 5. So you're usually in good shape if you're attending those regular appointments. Okay, and so now probably Joshua and I had a meeting yesterday, and he said, here's what I'm getting a lot of questions about. And I said, I am too. So it's not just kindergarten parents, but K through 12 parents are asking about this. And Dr. Linker kind of stole my thunder, but that's okay. We'll say it again. Open enrollment opens on March 1st. Please do not complete that information now, because that will be requesting for your child to go for the rest of this year. So if you do it now, I'm just going to discard it. So until March 1st, that application is not available. Open enrollment, the list will be approved at the next board meeting in February, which is February 6th. And it is very similar to the current list. So you can go online and see what schools were open this year. And it's very similar, but not exactly. Oh, can you go back? I'm not sure what that last part was. Oh, and we are working with the board. It probably will not affect most of the people in the room, but some changes to the policy. The open enrollment period says it opens from March 1st to March 15th, but really we never close it. So there are some just ongoing concerns about kids leaving, mid-semester, mid-quarter, and some things that we want to look at, as well as some of the kids. Open enrollment is it's not a right, it's a privilege. And so there are attendance and discipline expectations with that. Not perfect for either one of those, but if there are chronic issues in either one, you could be revoked and have to attend your homeschool. And so for some children, that is an issue, and we're just trying to clarify some things with that. Okay. And so every once in a while, I will get an old form on paper, and we moved a few years ago during COVID to an online open enrollment form. So you must complete that process online. That link will take you there, but again, it's on the website under student assignment. And you will, if you complete it on March 1st, you're not going to find out March 2nd. No one gets approved until after the 15th. Again, when we had the hard copies, it was like a rock concert. People were lined up outside when we went to the central office that first day. And so, we've never had to do a lottery. I hope we don't this year. My first year, I certainly don't want to do that. But do not, if you submitted on March 1st, and call me that afternoon or call one of the assistants in my office, we're not going to update you. You will not find out until the 16th. So don't call, don't email. We may just not even respond due to the number. Currently for this year, we have 1,400 new requests for open enrollment this year. So it's a lot to process. And it's one of just many things that I do. In the past, it was with a different department. And so, again, also look at the list. Requests, if you ask for a school that's not on the list, Wintergreen is one of those schools, they're not on the list, they're not going to be on the list. It will be denied. So you can only ask for open enrollment in an open enrollment school. And then also, please don't call our office and ask for which school is best, because my answer is going to be very different than other people in the room. My children attend Bethel School. So I love schools north of the river. But for your child, I might not recommend that. So every child, as Dr. Briney was saying so eloquently, like every child's different. Even your own two kids are different. And what school fits one kid might not fit another kid. And so again, we think each school has unique offerings. And so we're not going to recommend a school. I don't think Parents for Public Schools does that either. They just share, here's all the schools and I'll help you. And I can tell you what I know about each school. But again, it's up to you to kind of figure out where your child fits. I anticipate there will be questions, but that's all I have.
So one quick thing, if you follow our Facebook page, I shared a post yesterday from PCS, and there's like an arrow pointing to the part of the tab to look for open enrollment information on the PCS website. Go to the website and you're like, where in the world do I click? Go to the PPS PC Facebook page and you'll see an arrow pointing to where in the drop down to look. So
No, I'm sorry. I'm trying to deal with a situation and it's,
just a second. Jennifer, you may want to mute. So one of our presenters is going to join via Zoom. So we're trying to connect that. So she's now joining on Zoom, and in a minute we'll do that. Next up, I want to introduce Gretchen Wilson. She is the PCS Director of School Nutrition Services and answer all questions about food related to PCS. Thank you.
Thank you for having me. I'm so glad to be here. I've also got a student here in Pitt County Schools. He went to Hope Middle and now he's at the early college on the Pitt Community Campus. So we have great things going on in Pitt County Schools, and we're glad that you're going to have your kids with us. There are some things you need to know about the food service and what's available. So with Pitt County Schools, we do offer for our feeding opportunities, breakfast and lunch. We do have after school snacks at the schools that apply for that. So that's individually done. If whatever schools you're enrolled in can give you if they have that opportunity. We have the Fresh Fruit and Vegetable Grant currently at 7 schools. The Fresh Fruit and Vegetable Grant is only an elementary grant that we can do, and they have to have 50% need. You're going to hear a lot about need as you come into the school system. And so that's done annually. So I do not know next year what schools are going to have it, but the list up there is ones for this year. So as you go around and do some school visits, you might see that occurring. And that program, we do offer a fresh fruit and a fresh vegetable outside of the school lunch, school breakfast, twice a week. So one day a week, they get a fresh additional fruit and a fresh additional breakfast. That's done in the classroom. They get additional education on that item and just helps them learn more. Usually it's more of an enhanced item than we offer on our line. It's usually more costly and stuff, or items that are just not well known to the common child. So we bring stuff in to get people maybe wanting to get another product they usually won't buy at the grocery store. Is the intention of it, to bring more things to your home to eat. So we also have summer feeding. That's what we're going to right now, trying to get everything ready for the summer. And we also feed the Juvenile Detention Center every day, breakfast, lunch, and dinner. And we have a daycare that we provide meals for. So we do a lot of different things within Pitt County Schools out there. So we do have, again, the meal prices were shown on that. That can change, but keep on that side of that. Right now it's $1.25 for breakfast and it's $2.50 for lunch. But on this one, I want to tell you how we get those pricings, what you have to know for a parent, okay? So we determine every year, starting July, we're July on through June, the eligibility of a student, okay? When your student walks in the door next fall, they're going to be considered a full price student until we know otherwise, all right? So that's where if you feel that you have the need for it, that you need to be considered for reduced or free meals, you have to complete an online or at school paper copy of our free reduced meal application. This year is this color, it changes each year. But there's information you have to fill out with family size, with income, and you have to sign it and send it in to us. We will have that available usually between the second and third week of July. We have to get it approved every year from the state, updated, and we cannot post it until July. So again, what's posted right now, do not touch that. There's no reason to do anything that's not going to be the 22-23 school year, we destroy. So if it even if it comes in next year, we try to make sure the schools have them taken away and destroyed, but they do sometimes come up. So make sure if you do need an application, it's going to be 2022-23 school year written on it. Make sure you have the application. It will be on the Pitt County School website. It will be at your school. So when you go to open house, if you miss that, your front office has it at the school, your manager will have it at your school, or you can come up to the central office. We're on third floor, and we'll be glad for you to fill it out there or to take it home with you. You can print it from the website, fill it out, and you can then download and send it over by a secure email. We started that 2 years during COVID, so that worked out really good. So that way some parents, rather get it to us faster. We have 10 days upon receipt. That means upon receipt to Miles, not upon receipt to the school. So once it hits our school nutrition office, then we stamp it in that date. We have 10 days to get those done. Currently, we do them within the same day, but at the beginning of school year, when you have hundreds come through, it could take up to 10 days. Usually it's a 5-6 day turnaround. We do a letter home to let you know your status if you did turn in an application. So you will get a letter home after it's been approved, but your child will go ahead and get that status immediately. So your child might go ahead and get a free reduced meal before you even know about it at home. So if you had money on their accounts, whatever, it would be sitting there. Another way you can become free or reduced is through direct certification. We start pulling that data as soon as we are notified by the state it's available. Hopefully it's available late July. Then we send those letters home too. So sometimes if you get a letter from us in the summer, you will not have to then do an application because that you've already been approved for the year. So you don't have to worry about it. And every year that's the same thing. We send those letters home as soon as we can. Sometimes it's late July through August and then throughout the year. So you may never apply but through application, but then you'll get a letter from school nutrition saying, your child has been approved for free meals or reduced meals from that date forward. You're good to go. Any charges though up to that point would still be the responsibility of the family to pay. Okay. So until we know there's a new meal status, they are considered again a full price student. So I want to make sure that's understood. So we will be charging your student from the first day of school unless we know something different, which has to do with any siblings. I think there's only a few in here that said they had siblings in the school. But if you have a sibling in a school that's already got a free or reduced meal status, the meal status does carry on the next school year, carry over for 30 days or until they get approved up to that 30 days. So if you come in there or if you have friends that you're going to go back and tell, if they have siblings in school, if they have kids already in school and they're free reduced, we need to know they can go tell the manager during open house. Andrew will contact my office. We can extend that benefit. But if we don't know, we can't extend. And so we can only extend it once we know. We can't backtrack either. So again, there may be charges or something on the account because we do not know the information to match a sibling. So that's the responsibility of the parent to inform us if there is any sibling matches to do. So I want to make sure you understand that part. The next item was talking about the 30 days, the sibling match, and then the applications again are on our website. And again, do not do it like Ms. Karen said. We can't do anything until the new one comes up for us. So please don't turn in the current application. Plus, if your child is not showing up as enrolled, you're a kindergartner, we can't match them up. So until the school gets them in the system, you might have sent me an application in July. It's going to sit there until we can find the child to match up to. Okay, so they're not enrolled in the power school. I can't match up. There's no approval process going through, and we try to get those matched up as soon as we can. Dietary needs, if you have any special needs of your child that has to make us have changes of our posted menu, we cannot make changes for federal law. We cannot touch dietary changes without the UMN unique mealtime needs form completed and processed. So that's going to be the responsibility of you, the parent, if you didn't make changes. If you have a child that's got a lactose problem, has diabetes or gluten or any celiacs or any things that we need to go through and make changes, we cannot do it legally until we have that form completed and signed by your physician and turned in. School nurses look at it, we look at it, we process it, we train our staff at the school, the managers and our staff, of how to adapt to the child's need. Okay, so until that gets done, you can either decide yourself to send a meal from home, which we really want to eat with us, or you can look at the website. We have our menus posted. And we also have the calories, carbs, and information for each menu there. So you can go and look at it and you could write down and let your child know what you want them to pick up until this been processed. So it is up there. You can do some research yourself if you would like to do that. Or if you don't want to worry about those and you are either working on your child if they need to increase weight, lower weight, whatever, you can look at that and help your child make their decisions of what to choose to eat at school lunch. Because we can't tell them what they can pick. We give them the offerings. Usually there's 2 meats, usually there's 2 vegetables and 1 fruit at the kindergarten age that they choose from. So they have to take 3 items on their tray. So they have to go through. Milk's not required. Milk is one of the items. Old school teachers still think sometimes like, no, milk's not required. Milk is one of the options. So they, their entree, they get bread, again, they're gonna have 2 vegetables and a fruit to choose from with that meal. They just have to have 3 items on their tray, but they can have all those items on their tray too, okay? Usually there's 2 entrees for them to pick from. Now, there's times it doesn't happen, but the plan is to have 2 up there, and there's usually 2 on your posted menu. Breakfast, again, is there for them. I even say, even with my own child, he eats a little bit at home, he gets to school and he gets breakfast. You know, they've been on the bus for an hour or whatever, been an hour and a half since home. Breakfast does not last on your system long. A lot of our schools are free. If you're a CEP school, I did not mention that, but if you've got free or reduced status, or if you're part of a CEP school, you know, let them come in and get that breakfast. Let them come in and get some more calories to get them through the day, especially if their kindergartens haven't been used to transitioning. The time periods aren't going to be the same as y'all ate at home. So that might be good for them to come in and have part of the breakfast to help get them through till their lunch break period. Since I forgot to tell you about CEP, I'm going to say that now. Community eligibility provision. That is something I have to register with the state every year. I have to use April 1st data. Currently, the schools that we have posted on the website are this year's approved schools. Next year, we may have more, we may have less. Right now, it's looking good. I'm hoping to have more, but one of our big groupings, we have 2 groupings of CEP schools. It dissolves this year, and I have to make them to a new group. So I'm hoping we'll be able to keep everybody that's CEP in it and grow. But if you're a CEP, community eligibility school, and right now there's 25 of them, those students do not have to pay for their breakfast or lunch. Okay, it does not matter of your financial status, it's free to all. So those schools, I definitely hope you come and eat, but I hope you eat at all of our schools. But those schools, I'll make sure you know that meal does not cost anyone. We do offer at lunch bento boxes and chef salads. A lot of people don't realize that. Different days are different options for those extra entrees or for the students. So that's something they can choose. It doesn't have to be for upperclassmen. The kindergartners can pick that too. And all of our snacks, if you are going to be a box student, hope not, but if you want to bring your meal from home, get a cold milk from us. You know, that way you don't have to worry about temperature control in your milk boxes, you know, that you bring it in your lunch boxes. You can get juices from us. We have juices and milks. They're 100% juice. We have all of our snacks meet smart snacks. So they're low calorie, low sugar, low sodium. They meet all the requirements for USDA regulations. You can look up smart snack rules if you would like to. But I'll let you know that everything, even our ice creams, meet the sizing stuff that is good for their initial day's amount of intake. So it's available for you at a reasonable cost. So I want to make sure you knew that was there. If you want to supplement what they get from school or something they're bringing from home, they can get their chips from us or whole grain, low sodium and stuff. It might say Dorito, but it's not the same Dorito at the grocery store. It's going to be a little bit more quality and better than it is at the grocery store. And I think that is all I have on the list. So I'll answer questions at the end. Thank you.
So prior to starting my role with Parents Public Schools, Cook County, I worked in the school system as a teaching assistant. And I can tell you that our food staff at our schools work very hard. And TAs work very hard for your kindergartners to open the little milks and little packets of ketchup. And so your children will be well taken care of when it comes to meal time. So our next 2 speakers, first we're going to hear from Lori Reed, who is the PCS School Nurse Program Manager. And then we're going to hear from a local pediatrician. And so those 2 kind of pair together. We just want you to have all the information related to medical needs and related to our schools. So Lori, thank you.
Thank you for having me. I'm so glad to be here. Excuse me. So I've been with Pitt County Schools in the school health program for about 17 years, and most recently as the school nurse manager. And I'm also a mom of 4 graduates of Pitt County Schools, so it is possible to actually start in kindergarten and get them all the way through successfully in high school. And they really do a wonderful job in our school system. You may wonder a little bit about why my PowerPoint is actually an ECU Health Medical Center PowerPoint. And the school health program is a little bit unique in Pitt County Schools or in Pitt County in that it is a collaborative program between the ECU Health Medical Center and Pitt County Schools. So the school nurses are actually employed by ECU Health Medical Center here in Pitt County. However, we do work very, very closely. We fall under the umbrella of Karen Harrington Student Services Program. So we work very closely. We do follow the policies and procedures of Pitt County Schools. But we actually are employees of ECU Health Medical Center. So let me just talk with you a little bit about, we're going to harp on this health assessment immunization requirement. And I apologize, but this is really a big deal. And as Karen mentioned earlier, we do unfortunately have to exclude students after that 30-day grace period. And we really, really, really do not want to do that. And the school nurses work really hard with families to try to ensure that they do meet their requirements for entry, but unfortunately they are not miracle workers and they cannot get you last minute appointments for those health assessment appointments in their pediatrician's offices, just because those appointments do book up very early. And I'm sure our pediatrician, who's going to speak after me, will attest to that fact as well. Please, if you have not already made that appointment, go ahead and get that appointment scheduled for your rising kindergartner. And the health assessment requirement, excuse me, is actually a North Carolina requirement. And it's not just for kindergarten students. So if you happen to be a family that's just recently moved to Pitt County or going to be moving here, it is a requirement for any student that's entering Pitt County Schools for the first time at any grade level. So of course, that's going to be kindergarten with your kindergarten students, but if you have older students as well, if it's their first time entering Pitt County Schools, public schools, say they're coming from homeschooling or private education, they do have to have that North Carolina health assessment completed. To answer the question of our mom from earlier, it does have to be completed within 365 days of the first day that they start kindergarten. So I don't know that exact date because I don't know what our first day of school will be yet in August, but as long as your student has had their physical completed since August of 2022, into August of 2023, they should be okay. Your physician should be able to go ahead and complete that North Carolina health assessment form for you. And it would be considered in date for the upcoming school year. I did bring a few of those forms with me today, and they're on the back table. I brought some English and Spanish versions of the North Carolina health assessment form. It does have to be on that specific form. You will get a copy of that at the kindergarten registration as part of your enrollment packet, but for some of you parents that maybe already have those appointments between now and March or have had them in the last couple of months and you want to go ahead and get that completed by your physician, you can pick up one of those forms before you leave today. All right. So the next thing that you will have to do is have completed immunizations for your students. So immunization requirements are required by the state of North Carolina. And this is just kind of a listing of the North Carolina immunization requirements. You can always go to immunization website, North Carolina immunization website. You can talk with your child's pediatrician or the health department to ensure that your child has all their required immunizations for kindergarten. It's going to vary based on their age, when they started their immunization series and so forth, but it's really, really important that they have their most up-to-date immunization record along with that North Carolina health assessment when they attend school on that first day. There is that 30-day grace period that the state does allow you to get those things turned in, but I would highly recommend that you try to go ahead and get those turned in as soon as possible and really by their first day of school if possible. So what are some of the other things that we might need for you to have from a health perspective for your student? We do have a required medication administration form as well. If your student would need to take any type of a medication at school, whether it be prescription medication or an over-the-counter medication, an emergency medication, a daily medication, any medication, anything that your student might need to take at school would have to be accompanied by a completed authorization for medication at school form. I did bring a few of these forms as well on the back table. But just understand that the policy does allow for students to receive medication with the authorization form at school, but they highly recommend that if it is a medication that can be given at home before and after school, that you go ahead and do that. Okay. Please do not ever send medications with your student in their book bag to school. That is against the policy. Students that are in kindergarten, younger students, K-8 students are not allowed to carry those medications on their person back and forth to school. There are some exceptions for emergency medications, and if that would be the case, the physician would have to allow your child to authorize to self-carry their medications. But as far as kindergartners go, please do not ever send a medication in your student's book bag with them to school. And don't send a note to the teacher. Please just give them this today at lunchtime. Unfortunately, they're not going to be able to administer that medication to your student. If it's a short one-time type of thing, or 2 days, 3 days, if you need to come out to the school and give that medication, that is allowed. But please don't send it with your student in their book bag. Let's see. So these are a couple other additional forms. If you have a student that has asthma or has a severe allergy, so something that might cause them anaphylaxis, we do have asthma action plans and a severe allergy action plan. And those are basically emergency plans that we request to have on file for your student, along with that medication form, if they're going to need their inhaler or they're going to need an EpiPen or Benadryl or something like that. We do ask that you have the either the asthma action plan or the allergy and anaphylaxis plan completed by your child's physician. All of these forms are going to be available except for the asthma action plan on the Pitt County Schools website. The asthma action plans are actually initiated by your child's pediatrician if they have a diagnosis of asthma. So if you ask your pediatrician at that health assessment appointment for those forms, they should be able to complete them for you at that time. All of these forms, the medication form and the severe and allergy action plan, they all actually require the doctor to sign them, and they require the parent to sign them as well. So please make sure that you, before you bring those forms into school, please make sure that you sign them as well. I can't tell you how many times we have to make photocopies of them, send it on home to you for your signature, and then, you know, get that back. So, and that just delays the amount of time that your child would not be able to have that medication. So please make sure that you sign it if your student has that on file. All right, so the next slide is just where can you find these forms? As I mentioned on the Pitt County Schools website, under departments, there is a student services tab, and you can find the school health program and school nurses under that tab. We do have many of these forms, including the unique mealtime needs form that Gretchen has already spoken about. If your child does need some sort of a modification to their diet because they have a gluten intolerance, or they maybe have a severe allergy, like if they have a peanut allergy or something like that. The earlier we can get that form completed and on file, the better, so that we can make sure that we get your student's cafeteria record flagged, and we can ensure that your child does not receive something that they should not receive in the cafeteria. The severe allergy action plan, the medication authorization form, and some other various forms, the North Carolina Health Assessment form, those are all available on that website under that link. All right, so this is just a picture of the current school nurses that we have. We actually currently have 26 school nurses to serve our 41 schools and programs in Pitt County. So as you can probably figure out, that means that there is not a school nurse in every building every day of the year. So just to talk to you a little bit about the school health program and the roles and responsibilities of the school nurses, so that you're not surprised maybe when you get a call from your child's teacher at the school saying your child is sick today, they're running a fever, or they threw up. It may very well be your child's teacher or teacher assistant that gives you a call, and not the school nurse, because the school nurse may actually not be on school grounds that day. The school nurses do communicate very well with the classroom teachers and teachers assistants about illness, policies and protocols, so that if the teacher gives you a call and says, your child is sick, I would ask that you please honor the teacher's request. If they need for you to come and get your student, or to have somebody come and get your student, that you would do that. Unfortunately, sometimes we do have students that become ill at school, and when the teacher calls, the parent says, well, I would really like them to be seen by the school nurse before I'm going to be able to come and get them. And while we would love to be able to do that for you, unfortunately, there may not even be a school nurse in your building that day. So please understand that it may be the teacher or teacher assistant giving you a call. The school nurses in Pitt County don't really serve in a traditional school nurse role. I'm not sure what it looked like when you were in school, as far as having a nurse that sat in the office and had a bed, and the sick kids went to her office and received medications. The school nurses in Pitt County first of all, they do not keep medications in their office to administer to your student. So we don't have any stock medications we'd be able to give your child if they would become sick at school. They're also in a care management role or case management role, which what that means is that they are identifying those students in Pitt County that have the chronic health conditions that they might need to assist with developing a healthcare plan. And I'm going to go ahead and Go to the next slide, talk a little bit about the. So this is a lot of information and I'm just gonna summarize it, but as I mentioned, we have 26 school nurses. They serve over 23 students. Pre-K through early college programs, and approximately 22% of these students have one or more chronic health condition. So that's about 200 students with a medical condition per nurse in Pitt County. In 21 and 22 school year, the nurses developed over 4,500 healthcare plans, which they implemented, and they provided oversight to 2,500 student medications in the county. So the primary responsibility of the school nurses is to provide case management to the students with chronic and special healthcare needs. What does case management mean? It means they're identifying the students with special healthcare needs. You can go to the next slide for me. Okay. They're developing healthcare plans and emergency action plans for those students. They're coordinating the care of those children that are in the school. They need special feedings. They may need care for their diabetes. So they're coordinating that care with the teachers. They're providing education to the teachers and delegating the medical procedures and medications. So they also monitor student immunizations and their compliance. So these are the main priorities of the school nurses in Pitt County. We do additionally health screenings, health promotion activities, and continuing education. That's the fun part of our job. We love it when we get to go into the school, into the classroom, and talk to the kindergartners about washing their hands and just how to remain healthy. That's the fun things that we get to do, but that's after we're, taking care of all the case management duties that we have. So I just want you to understand a little bit about that. We communicate very closely with our teachers and our administrators and our counselors and our social workers. We work very well together. You want to go ahead and go to the next slide. It's very much a collaborative partnership between the school health program and Pitt County schools. And our goal, of course, is to provide a safe, healthy, and equitable learning environment where all students can learn and succeed. So I would highly recommend that if you have a student that may have some special healthcare needs, or you're just concerned about some things with their health as they transition into kindergarten, that you reach out to the school where your child will be attending and ask to speak with the school nurse. She may not be there at that moment, but you can always leave a message. They know how to find that school nurse that covers that school, and they can call you and set up a time to talk with you and just provide you a little bit more information. But we will definitely make sure that we keep your children as healthy and safe at school as we possibly can. Thank you.
Thank you, Lori. And next, we're going to hear from Dr. Jennifer Crotty and Dr. Tran, who are local pediatricians here in Greenville, just to kind of talk about a little deeper and help us understand when you need to get into their office to get your please.
Great, thank you. Yep, so I'm Jen Crotty. I am a pediatrician here, and I've been doing this with Pitt County Schools since the beginning of us doing the Parents for Pitt County Schools. I'm excited that a pediatrician was included. And you may think to yourselves, why do pediatricians need to be included for kindergarten readiness? And it's because we think that education is health. So it's really, really important to us. Dr. Tran is one of my pediatric residents who's working with me too, and she's going to talk a little bit more detail about the health forms and what we can and can't do for you in our office. And I will kind of also talk about the discussion about the timing of the physical forms, because that is really important. So if you want to go register your child for kindergarten in April or in May, you don't have to wait until their next physical is due. By the way insurance works, it's 12 months, right? 365 days between your child's physical for the year. So if you came and saw me in July of last year and you want to register your child in April, I can use that physical to register your child, right? I can fill out the form from that. You still should take your kid for their next well check in July, but you shouldn't feel like you can't register your child on time because they had a physical. And then the other issue is vaccinations. So as we talked about, there is no personal exemption for vaccinations. There can be medical exemptions if you have not vaccinated your child on the routine vaccines. And that doesn't count COVID and flu, although we highly recommend those as people who see that all the time. But those are not on the required list of vaccinations. But your 4-year-old, if you went for a 4-year-old well check and your kid got all the regular vaccines, then there aren't any 5-year-old vaccines. Your kid is vaccinated. And so just kind of in your mind, if you went to the 4-year-old vaccine and you were like, we will wait till later, then you do need to get them vaccinated before they start school. And so that's kind of my point I wanted to make. And I'm going to let Dr. Tran kind of talk a little about forms and practicality of it.
So the form kind of expect the visit to be a little longer, especially if your kiddo has like any other medical conditions as well. So this form is what they posted, the health assessment form, and the top part is for parents to fill out, and it's in Spanish and English. And then the bottom part is what we fill out, and we usually go through it with you, any medications that's prescribed, and we talk about whether is it just at home or at school as well. And then, any allergies, whether it's medications or foods and special diet is also listed on here. And we also do a hearing and vision screen at that visit, or if they had their 4-year-old visit already too, and that's already done, then we can check that off as being completed. And we also evaluate them for any developmental concerns, and we can also address that at that time too. And if your kid needs any special services like speech therapy or developmental occupational therapy, things like that, we can address that. And then another thing is also if you're worried about education, like IEPs or 504 plans, usually we talk about that too, but that's usually done through the school, and we kind of can help you navigate that as well if you feel like your kid needs that, especially if they have like a diagnosis of ADHD. That would be something we could talk about. And during that visit, we get them up to date on their vaccines, and we print out their immunization records. And if they need any medications administered at school, such as ADHD medications, if they have a diagnosis of asthma and they have an albuterol that needs to be given at school or kept at the school, and a spacer as well. So we also have the med authorization form. So that one we fill out as well, but the parents have to fill out the bottom part too, to give the school permission to give the medication at school. Another thing we also go through is asthma action plans, or the allergy plans that our previous speakers talked about. Some of them are electronic now, so you might still see this, but you might also get an electronic record or electronic form. And that just makes it easier. So if you like misplace it, like our staff can help print it out and give it to you. If you ever need it, you can just give us a call as well. I would say come early, because August and September is very busy. Sometimes it takes even longer for us to get those forms filled out for you, like turnaround time. Usually if we're busy, we give like a few days and we say, come back and grab the forms. We'll have it all filled out and left at the front office and to ask for it. And if you get the visit done early, like in the next few months, there's a little more flexibility, and it also ensures that we get all the medicines like sent to the pharmacy. You can have it in hand, especially EpiPens is another important one. Of course, if you have your kiddo has any type of allergies. Other things. Anything else? That's
Yeah.
it. Yep.
So then, my general, so I do have 2 kiddos in school. I have a 16-year-old and an 11-year-old, and they went through the county. They went through Wintergreen, Hope, and now Lord help us, Conley. And so I and my kiddos have medical issues. So this is all very personal to me. But I kind of want to know, how many of y'all, show of hands, are first-time kindergarten parents? Okay, so this is the real practical stuff that I think is helpful from a pediatrician, but also a mom point of view. So pretty much all kindergartners, and this is like school readiness related, but also, I mean, it's just making less stress on your kiddo as well. So pretty much all kindergartners will have their homework for the first year will be 20 minutes of shared reading with you. So that is not something that you already include in your schedule, you know, over the summer, when you guys are make that a habit, make that part of your schedule in the evenings, part of bedtime, part of after dinner, because that'll make it a whole lot easier when that becomes their homework, when they have to come home and get it signed off with you, that's already part of your family habit. There's nothing that says you can't send your kindergartners to school reading already either. So the summer reading programs are awesome for them to be a part of. So they're the habit of going to the library and reading and picking out books on their own. And that also takes away some of the stress of school. If your kid's not stressing out about the academics of learning how to read or learning how to write, if they've already gotten a leg up. I'm not saying you need to like enroll in Khan Academy or do anything crazy like that. Just that is really part of making the life transition easier. So that's the one thing I would say is it's really, really kind of like making sure that becomes part of a normal thing. Most of us, unfortunately, do use screens a lot more than we should with our children. And so like trying to make that transition into when we're going back to school, recognizing the kids do get screen withdrawal. So they are going to be on some screens at school. and probably some at home, but trying not to make that a big part of their day so that there is a lot more fine motor skill stuff, Legos, Barbies, cars, like using their little fingers and crayons are really, really great for them. Socializing your child. So if your child is in pre-K or daycare, that's fantastic. Like we talked, like I think Dr. Briney talked about seeing around kids that they're not really used to seeing. And if you don't have an opportunity for that, then go to library story times, get your kids around other kids, get them used to having to sit and listen to somebody else take a turn. That's really, really important. That's where we see a lot of problems with kiddos having, is this a behavioral issue? Is this ADHD? Or is it just a 5-year-old who's never had to sit still for 20 minutes? Like those are all things that are fair. If you go to church, having your kids sit with you during the church sermon and have to sit still for 15 minutes, give them a book or something to do, but kind of that training is really, really important. If a kid who still takes naps, I had children that stopped napping at 18 months, so I don't know what that would be like, but for those of you who are blessed enough to have kids that still take naps, drop the naps in the summer, a couple of weeks before school starts, and bump the bedtime up. There's nothing that says your kid can't go to bed at 7 o'clock at night. Some of you may come home from work late and like want to spend an hour with your kid, but that sleep those first few weeks of school is really important, and don't expect a lot from them when they come home from school the first few weeks of school. They're going to be like, oh my God, like they're just going to go in the corner. Don't plan a big trip the weekend after school starts because your kids are going to need the weekend to recover. And these are practical, like family hints that I have learned over the years, that we plan trips in the summer and we plan trips a few weeks into the year, but the first weekend of school, after school, we're just like, we're going to lay around, get caught up on stuff, buy more, whatever we missed off the school list. That's really, really important. And then the last thing, which maybe we think is crazy, but not only get your kid ready and pack their lunch bag the night before, pack the stuff the night before. That's a great habit. Have them pick out what they're going to wear the night before school. Like that's a great habit to get kids into every single night as they're getting ready for bed, pulling out your clothes for the next day, because it takes away from the stress in the morning. And if they change their mind in the morning, they want to wear something different, that's fine. But that way you're not like searching for black leggings or having to do wash, like those kinds of crazy things. And then maybe a couple weeks before school starts, do a test run. Like do a test run of getting up at the time you would get up, figuring out how to get there. Figure out that honestly, to get into school, it's about the line is insane. The first day, I had wintergreen kiddos. Like we got to school an hour before school started the first day, and we were just getting in as the bell rang. So just recognize that some places are insane, but kind of get a test run and figure out like, what are we going to eat the first day? What are we going to pack for lunch and all those kinds of things? That will take a little bit of the stress off of you as a new parent, as well as your kids too. I think those are all the things. Yeah, great. Good luck. It's really fun. Okay.
We have one last speaker, and that's Jennifer Matthews. I'm going to turn her around in just a second. She is a parent that has been where you are. And so we just wanted to give her an opportunity to share from a parent perspective. What's coming up for you? What does she want to tell you as a parent, getting ready to walk the steps she's taken? So I'm going to figure out the best place to do this so we can hear you and they can hear you. I want you to be able to see her too. So this is Jennifer.
Hi, everyone. Can you hear me?
I'll move the microphone closer to you.
Okay. I am so sorry that I am not there in person. You all know life happens and life just happened. I'm gonna give you my perspective. So first of all, I would say take a few deep breaths. Because I remember like when my oldest I have two boys in first grade, and I remember that first transition to kindergarten. It was a little rough, but also super exciting. I think that Jennifer did a great job. She gave you some great practical tips, like write down all of those things. And then I'm gonna add a couple of things to that. I would say number one, be involved in the PTA or somehow be involved in the school. I became a part of the PTA last year as a kindergarten parent. I am the PTA president this year at Wintergreen Primary. And it's given me an opportunity to really get to know some of the principal and some of the staff and the teachers a lot better. And it, like, I feel like I have a presence at the school, and for me, that's really comforting, as my kids were in kindergarten and now in first grade. And you can, most schools now are allowing teachers or like teachers want parents to come back in. For a long time because of COVID, they weren't able to do that, but now they do. So even if you like email, connect with the teacher, and definitely share, that if you want to help out in the classroom or wherever you can, then, that is an opportunity for that as well. Some of the more practical things, a lot of the schools post school supply lists over the summer, which if you are a type A personality like me, I loved having that. And I remember seeing it. I followed the schools on Facebook. I saw it all and I went out, I took the kids and we went shopping for school supplies. And then we went for open house and got a different set of school supply lists. So I would tell you that what they do is great. They provide sort of like an overall, this is what you kind of need by each grade, but teachers have nuanced things that they like for their supplies. So there's some of the things like pencils and stuff like that, yes, you'll probably definitely need, but also know that you will get a different school supply list at open house and it may or may not be consistent with the stuff that you selected. I mean down to like the specific brand of crayons and stuff like that. So just be aware that it kind of threw me for a loop. And I was not expecting it. And then first grade, I learned and I was like, okay, here we go. And I was better. Jennifer mentioned Carline. If you plan on dropping out, I work full time. So, but the first for kindergarten, like I took my kids to school. Carline can be insane, and my kids are at Wintergreen, and Jennifer, it wasn't lying. Like it would literally take an hour to do drop off in Carline because so many people want to drop their kiddos off. But the schools are doing the best that they can to make it as quick as possible. And even in the PTA, I remember our first PTA meeting and a lot of the parents joined and were like, what can we do about Carline? And I tell parents, like, in all honesty, the only thing you can do to improve Carline is to not drop your kid at school so that there's one less kid in Carline. Because that's the problem, is there's so many kids trying to be dropped off that, like they're trying to accommodate that the best that they can. And so unless you don't want your kid to be dropped off and you want to put them on the bus, then it's the number of people in line. But it does die down. I think that the first few weeks, parents are like really wanting to drop their kiddos off. And then after a while, they're like, yeah, they can just take the bus. And so it does die down, and that is both in the morning and in the afternoon. For kindergarten, I think most of the schools I learned had Wintergreen calls it an Independence Day. So I could take my sons to school the first 2 weeks, and then after the first 2 weeks, they have to do it on their own. I actually only took them the first day of school and let them try it out on their own the rest, but I did pick them up from school for the first week just because I was really just excited as a parent to see what was going on and what they were learning. And it was I had the ability to do that. But after that, they just took a bus. And that's what we do now. So, the other practical thing that we did, and I've learned, is practicing lunch. It is not normal for kids to know how to eat lunch in 20 minutes. And so we would practice at home. We practiced their lunch boxes, the containers that they would put the items in. We practiced juice boxes if that's what's sent with them. We practiced everything so that when they were at school, yes, the teachers are there to help them, but I've also done lunch duty. And it's a lot to help all of those kiddos undo all of their things. And so I am the parent that my kids are great with Ziploc bags. So if they have chips, I put it in a Ziploc bag. If they have fruit snacks, I put it in a Ziploc bag because it's hard for them to open those packages sometimes. And so just to not bother the teacher, I put it in a Ziploc bag, and that's what they've been sent to school with. Water bottles are another thing. The kids love, like the teachers love having the water bottles and for the kids in the classroom, and it's wonderful. But some of them are, I have learned, are very loud when they're spilt over. So try to get something that's maybe rubber that doesn't have like the loud metal clanking sound that can be disruptive. And also they break them a lot. So do not spend a lot of money on a water bottle because I have no idea how many water bottles I have been through in the past 2 years. So it don't spend a lot of money on a really great water bottle because it'll probably get broken. At this point, I've told my kids, if you keep breaking them, you're going to get like plastic water bottles. And that's what's going to go to school with you. I mean, the other thing that I actually learned, I'm in PEP, which is another program for parents for public schools that I would encourage you to participate in. As involved as I am in the school, PEP has taught me a lot about some of the inner workings of the school system that I just I don't have the familiarity with. But one of the things that I wish I would have known as a kindergarten parent is the idea about sending a letter or an email introducing yourself and your child to your teacher. Kindergarten for one of my sons was wonderful. It was a great experience. For the other one of my kiddos was not a wonderful experience. And we had some growth that we needed to work on. And in that instance, I think that had I sent an email to the teacher sort of introducing both of my kiddos, and, talking to them about some of, his specific traits and his needs, that it might have been a little easier. But also approaching it as a partnership. A lot of times, and I see it, teachers can be a little hesitant to want to talk to parents, or it kind of makes them a little uneasy, right? Because they feel like they might be attacked. So approaching it as a partnership and you wanting to reinforce some of the work that's being done at school, and then knowing that having the teacher know some of the things that you notice or that you're seeing at home. And approaching it really much as, saying like, we are a partner, let's work together on helping, my child. I think that would have gone a long way for me last year. But also don't be afraid to advocate for your child. Yes, your child is different in school. One of my kiddos is like off the wall crazy at home. And at school, he is such a rule follower. Like he sits in his desk. He doesn't, like, it's insane to see. I'm like, this cannot be the same child. But they're different at school and recognizing that. But also, your kid. And so don't be afraid to advocate for your child if you need to. Go to parent teacher conference, even if your kids are doing wonderful. And I hope they all are. Don't be afraid to make an appointment with it during parent teacher conferences, just to touch base so that you can, speak again one-on-one with the teacher. Last year my husband and I went to every student conference that we could with the both teachers. And it was a wonderful experience of learning and seeing what their work is. I'm trying to think about any other practical, just be as involved as you can be. I know it's difficult. Like I said, I work full time, so it's, I have 3 small children, so it's definitely difficult. But do what you can, and really, 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 please do not ever be afraid to advocate for your child. Because in a respectful, polite way, right? And then, because it really is sometimes it's just absolutely necessary. Homework, I was surprised about homework. My kiddos had homework every night, and it wasn't just reading for 20 minutes. And so we had to change our schedules to figure out how to make sure that their homework got done. And in some cases it was, like 30 minutes of homework, at least. In some cases it was longer, of homework that these kids were bringing home. And so we had to change sort of how we did some things. And you'll learn those kinks and figure out what works for your family, as you, as you go through kindergarten and are learning some of this stuff. But I don't know. Those are the things that I wrote down that I probably really feel like that I would like to share. I know this is weird, but do you have any questions?
So we're getting ready to move into our question and answer session with everybody. So
Okay,
if you want to hang out.
yep, I'll hang out.
We'll turn it back to you.
Yeah, I'll hang out. I'll hang out.
So, we have thrown a lot of information at you. So hopefully it's not overwhelmed you in an additional way. But we do want to take a chance to let you ask questions of these, presenters that have been so gracious to, share so much information with us. And do know that we will help connect you with them in a different way if you've got questions beyond today. And we'll make sure you leave here with my email address and you just get up with me and I'll help you connect with whoever you need to ask questions. So do we have questions? Not do we have questions? What is the first question?
I just have a question about the health assessment. So our son is in pre-K now, at Sadie Salter. So we did the health assessment, all of that stuff. Do we need to submit a new one for whatever school he will be attending for kindergarten?
Good question.
Yes.
Okay, I mean, the most recent physical, go ahead and you, it doesn't, speak up to, but yes, because you turned one in for pre-K, that's considered a separate program. Okay, so yes, you will need it and be what the newest kindergarten from their most, from, your students most recent.
And just lingo wise, you may hear us call the health system the blue form, even though it's really was not on the forever, but it used to. So a lot of us that are a little older call it the blue form. That is the health assessment. And then the vaccine records, you may hear us refer to that as NCIR or shot records. Those are all NCIR is the North Carolina Immunization Registry. So if your kid got shots in North Carolina, that is all into one big system. And like, so you hear us say, oh, here's your NCIR, that is what your shot record is. So technically, if your child has no health issues whatsoever, they need the health assessment form and the shot record or the NCIR, power.com, and that's all you need. If your child has other health issues, we've got a whole bunch of forms for you.
So the question was, for those that are watching later on YouTube, if you're in a pre-K program with Pitt County Schools, do you have to do the health form again? And the answer was yes, because it's separate from Pitt County Schools moving into kindergarten. What other questions? Yes.
And my child currently goes to speech therapy. As we transition in the school, and I sometimes there are services for school, how do I find out if it's qualified?
Okay. Dr. Bronny, you want to take that question?
When you come to enroll, go ahead and bring that information with you. So we have it readily available, give it to our PC contact and we'll sit down and see them review it. And then determine if you have to have an intake meeting, if the service is qualified, I don't school level, but anything we can get beforehand helps us prepare.
One of the good things to note about that is that there's a difference between an educational model and a medical model. So a lot of kids qualify medically for speech, but may not qualify educationally based on, what's developmentally appropriate. So sometimes there is a difference and that's frustrating and hard to understand.
So to summarize, if you're coming in with some extra support that perhaps speech that your child's gotten prior to kindergarten, from what Dr. Bryan was saying, bring everything you've got related to that to the school, and the school will then help work with you to determine what services the school can add to and support in addition to that. That makes sense. What other questions do we have?
Yes, I've seen that we had an ASVAB and we have a literal form, which we really don't have to do a lot. But I heard, I don't know which one that it's not actually stored in the nursing office. So I was wondering if that means the classroom teacher would have used that or how that works.
So, where do you want to take it?
Yeah, the emergency medications in the schools are actually kept where, where your student would be. So, generally what happens is the teacher would be provided with a copy of that authorization form and asthma action plan. And the nurse would work with the teacher. We provide asthma education to all the staff to make sure that they would know, what symptoms your student might need their inhaler for. And that way, even if the school nurse is not on school grounds, the teacher would be able to administer that medication. And they do keep the medications close to your, I can't speak for every single building, because every school might do it a little bit differently, but generally emergency medications are kept in the location that the student is kept. So when your child, goes out on the playground, the medication should actually be kept in a bag that the teacher might have that would be brought out to the playground. So the emergency medication would be where your student would be.
And I will have a little tip to that too, as a mom, is that whenever my daughter had a cold, had a cold, and I know that the school nurses aren't able to like get to every kid every time, and so I knew it was gonna be on the teacher, so when my daughter had a cold, that's really the next year when you albuterol. So when my daughter, I would write a note, this is before COVID, honestly, I would write a note that would say, my daughter has a cold, please follow her action plan today, just to trigger the teacher, because my kids are pretty asthma savvy, and they would be like, I need my inhaler now, but there have been times before where we had kids in our office who are not as asthma savvy, and the teachers don't think, oh, that's a cough, I should give their kid albuterol, because some kids don't get it for the cough. So if I ever knew that there was a trigger, I would just write it to the teacher, and the teachers were really, really grateful for that, because they felt like you weren't counting on a 5-year-old asthma. So just as a backup.
So just to follow up to that, in the classroom, we had a red bag that went with us wherever the students went, since we had several asthmatics in my classroom. And the nurse really worked with myself and the teacher to help us know how to use it. There was a log that we were training how to fill out so that we knew when the student was given what. So if you haven't heard it, I want you to understand that everything that's in place is to, number one, provide the high quality education for your student, but number two, to ensure your student is safe. So that's why with the food services and the laws that are in place to protect your students medically and the forms, and it's a lot of paperwork, but it's all in there for a reason. But the schools work really hard and to meet the needs of like that of your student. What other questions do we have?
I have a PC question.
Mhm.
Since our son is in preschool now, he does receive PC services. So for kindergarten, will the school whichever school we enroll him for, will they get that information from previous school? How does that work? Is the registration process different, or do they make a recommendation on where we should send it based on his IEP, or how does that work?
Okay, so Cindy and or Dr. Briney, one of you want to take that question?
I can take that. So the preschool, if your child is at City Sculpture, they will have a transition meeting, or if they're at any of our schools already getting exceptional children's services, they'll do a transition meeting, and you kind of maybe already did, but they will recommend what school your child, like, I mean, just depending on their needs. Most children will go to their home school. But if they're in a special program, not all schools have all of the special programs. So they would then say, here's either options or here's the school that we would recommend. And based on that, if it's not the home school, we would be able to. Right, yes, you would be allowed to, they would know ahead of time that your child's approved to go there. And most likely at that point, they would be providing transportation if that was something.
But you do actually have to register them in school, because that's one thing I think a lot of our pre-K parents, because they've been enrolled in pre-K already, don't recognize that they do still have to do the kindergarten registration process at their school.
Good point. So if you've been in a pre-K program, you still have to register for kindergarten at the school you plan to attend. What other questions? So my email address, and I'll say it twice if I need to, it's J Brazil, BREAZPALE, JBREAZEALE at pbspittcounty.org. So I can help connect you with any of these folks again if you have additional questions after leaving here today. If you haven't had a chance to look at the table, they brought a few resources with them. Take those with you. Any additional questions? Yes. So question about how to pay for lunches. Gretchen, we'll turn that question to you.
There's a few options. You can send money by school, and as I mentioned earlier, it'd be very good if you put it in an envelope with the child's name on it. Especially until we get used to it. You can, so you can send money for several days out, or you can send daily, that's up to you. You can go online, you go to the Pitt County School website, there is an online service. It's a third party, so there's a fee day charge. We don't get any of that. There's people processing. And with that one though, you do get the opportunity to sign up where if it gets to a $5 minimum, you want to go and bring it up to a certain balance and it didn't draft from your card. So you can get different commission levels. So that's available. But yes, you can, always contact the manager and check on the balance too, if you want to. If you do the online way, you will be constantly be able to see the student's account where the money's at. So that's the good thing about doing that, but there is a fee. But you can check with the, cafeteria manager. When you do go in for open house, you can take a check or money, cash or money order. We do not have any credit debit services to do that at school level. So if you want to use a debit or credit card, you do have to do that with that online service, okay? But you can do money order, check, like I said, all of those come in. You can bring some money at open house. And then you can just, I do it once a month for my child, I put money on it. Sometimes I have to use the service if I get down to that too low. So it depends on how fast you need to get it done. If you end up have money on your account and you change meal status to a reduced or a free status, the money's gonna sit there. Okay, they can use it to buy snacks and stuff unless you call us or email us to remove it. Okay, because the money will flow year to year. So whatever's left on the end of the year with the account will go to the next school they're enrolled in. It matches their school, so you don't have to worry about calling us. It will show up where that child is. At different grade levels, they're gonna carry a lunch number all the way through elementary. They'll get another number in high school, but they'll have the same number. Really practice, that's one thing, kindergarten parents, when you get the number, practice. They have to either verbally say their number, or they have to punch it in, or they'll get a badge. Okay, but if they forgot their badge, they're gonna have to verbally say, or they're gonna have to punch it in on a keypad. So please do work with them. The number's up to 6 numbers, so it's 4 to 6 numbers. They can learn it. I'll tell you, the kindergartners learn it better than fifth graders. So you just need practice. So definitely put that as one of your starter things to practice after you get your enrollment and get that meal number. Meal number you'll get as soon as that first day in, they'll get the meal number. At open house, if we have the enrollment and match them up in time, we'll know that night at open house we can give you their meal number. But we may or may not, depends on how fast our school and our system matches up, if we can get our new list in for the manager to have our open house. But we can take money at open house, so that's a good place to start. If you don't know your status, I'd say go ahead and put you in for a week. Again, it's currently, it may change. I don't know if our meal prices are gonna go up. It is $2.50 for lunch, $1.25 for breakfast. If you do end up with a reduced status, currently it is free for breakfast and lunch. The legislators took over the lunch copay this year. Next year, we're fighting to continue that, but breakfast will still always be free for the reduced child. So does North Carolina pays the copay for the reduced child's breakfast, but they're only paying the copay for the reduced child's lunch this year, unless you get word otherwise. And we're hoping to get that extended in North Carolina legislation. So I want to bring that to your attention. So currently, your free reduced child eats free. CEP, community eligibility provision schools, all categories eat free for breakfast and lunch. But again, just for snacks, you can put money on account, you can use the online source, you can get us cash or check the money order at the line.
Will say as a parent, the online is really helpful. We're like, where is that money going? Well, he was buying cookies and chips.
Yep.
And so we had that conversation that this is for lunch. If you want to add extra to it, we'll do that. Any last questions? Yes. Sure. So specifically, you want to speak to how buses, when you find out buses and how they're assigned?
So when you come register, get your address. When you get your address, it goes through Powerful. That's the system that you use in the county. So bus transportation, transportation department of 15 county, they'll start formulating lunch routes early in the summer. We get those before moving house. Many schools use similar practices. For us, for example, ours is the cafeterias. From the open house, that's why it's important to know. There's so many different resources, different stops that you have to hit up. You come into the cafeteria, we'll have the posters on our walls, with addresses or neighborhoods, intersections within the neighborhood, with an estimated time. What they say is be out at the bus stop 15 minutes prior and be prepared to wait 15 minutes afterwards. And that is a great rule without the first month of school. Because drivers are trying to learn their stops and their routes. The other making sure before buses take off, or get seated to the seat before they go on to the next stop. So it just takes some time, especially with this, our new ladies getting on the bus to the kindergarten, it takes some time. And you should get all that information out of this house. There are times where your address may not be that out of the house. Again, similar practice amongst our schools. We just have a little card for you to fill out that after your name, your number, your address. Friday mornings and afternoons, the day after the house busy for our assistant principals. They're going through their math quiz and everything, and then giving you a call that Friday and say, here's your test, and you're supposed to pick you up here about this. The biggest thing for that is just patience. It does take time that person is.
So, it's important, we talked about registering early, so that when you come to open house, they're already aware of your student. But those that are later, we add, I drove a bus for Pitt County Schools. So I can answer your question about where, it takes a few weeks to get assigned seats. We are very mindful that, or I was, that we had little ones, and so I put them close to the front. And so we work with each bus to make it the safest we can for the driver and the students, and we acknowledge and know that we have little ones that are getting on. That's the part of that. So, as he said, just patience. As a bus driver, learning a new route, and the route changed because we added students to it, just be patient through that. We're doing the best we can to get there on time. I didn't get yelled at too often for being late, but bus drivers are doing absolutely best they can to get to your stop. And our primary role is to get your student to school and home from school safely. Any last questions? Yep.
One senior that, but I'm older than my and the person that I spoke to said that they are not aware of the
So-
First, I apologize. That is not the truth. It is run through community schools. And I said, you go to the Pitt County Community Schools website, we'll give you a list of schools that have after-school programs. Not every school does. And that said, there's a small fee it's pretty affordable, but we have it on our intermediate side and our primary side. The kids report right after dismissal, and then they're opening till 6 o'clock. Not that there's an issue there, I'm always having to field phone calls, just because again, our student safety is the most important, but that is run through the communities. You get all the information from their house. I go to Pitt County Community Schools on the top, there's something along the lines of after, we put them back and has all their information. It is important, just like registering, just like making sure we're attending everything well in advance. Get your name on that list well in advance, and they do have a certain amount of slots, very, especially as we're bringing 600 kids. That's very good.
Does every school parent have an app? Not every school does.
Every school does.
So it's,
The numbers make it viable.
so it's dependent on the school. So it's a good question when you decide which school you're going to go to. It's a good question to ask if you're interested. Do you have a question?
Yeah, so it's bringing the child, are we encouraged to tours and registration, or just kind of wait to introduce that environment to the house?
So I can speak from the school.
First time away from the year.
Sure. From the school tour perspective, from our end, children are always welcome. If you think that's helpful for your child to see it, I encourage you to bring it to the school tour. Registration, I don't know that it's,
I think it would be a good idea to call the school and ask them, personally, us at Winter Green, we do our enrollment piece in our media center. And then while parents are filling out paperwork, we have staff on hand that are taking those kids and walking around the school, showing them the cafeteria, the gym, the music room, the art room, and then a kindergarten classroom. So we want our students, we want them to be able to see. Now, we have 200 staff members, and we have a large staff in order to handle that. Not every school has as many students, which means they don't have as many staff. I think many schools follow that same practice, but I would suggest call. Bringing them also it's not gonna hurt anything either. They don't do anything in regards to showing them around the school. The worst that's gonna happen is they have to sit and fill out paper. That's it. But I would encourage all the school that they do anything along the lines of a little tour with the child. I highly encourage.
I have one more item with that, though. Most of the schools that I haven't seen in the elementary side do bring in the kindergartners the first week or so of school and do walkthroughs before, in between grabbing so much, so the kids can get accustomed, and they usually tell them how they can pick their meals, how to key in the number, how to get their milk and stuff, where to sit at when they get to lunchtime and stuff. So those parts are going through to give them comfort level. Usually it's after the first week of school, they bring them through, get them accustomed to where they can go, where to sit, what to pick out.
As far as siblings, I know like closer in age, older, that can be in childcare. I would like to be born when my kindergartner starts. Is that gonna be something that's an issue, like having a newborn in walking through class?
Okay. Should not be. Again, that's another school. The past county schools used to give parents a month to walk their children into school. Well, it switched because of COVID and some procedures changed with that. So that would be up to the school. Now, here's the other piece. I would prefer, and I'm sure many other schools would prefer, that we don't bring extended family and some grandparents. But I don't see any problem.
Okay.
Yep.
Sorry, super.
Good question.
Any other questions?
Got one comment. So I could not, release the board list of open enrollment schools, because it's not approved yet. But I noticed that the Daily Reflector is able to, so you can read on that Daily Reflector. It is a proposed list, so until February 6th, it is not approved, but they have listed, so the one school that some of you might be concerned about is listed there, too. But I cannot say. That's probably for me.
You're also welcome to have school lunch with your kids, work it out with your teacher knows. Some teachers might have like certain times they want that to occur. It would be a la carte for any adult or siblings that are not enrolled in the school system, okay? So if you bring in your child and stuff with you, that's perfectly fine if the teacher's fine with that, but it would be a la carte. And it's good for you to eat the school meals, so they might try out new stuff too, because I've seen parents through the line, and they grab stuff, know the child I do about it, and they started eating it. So if you want to come to speak school lunch, I think that's a wonderful thing to do it with your child.
So don't forget the, around the room, there's QR codes. If you want to go ahead and just click that and save it for later to sign up for school tours. Again, they start February 8th through March 9th. Again, thank you for being here. And if you have any additional questions, reach out to me and we'll do our best to answer. Thank you.